I'm Kathleen Sakamoto, pediatric hematologist-oncologist from Lucile Packard Children's Hospital at Stanford. The research that is supported by the PCRF grant focuses specifically on CREB, which is a protein that's overexpressed in acute myeloid leukemia cells. Our goal is to develop small molecules or compounds or chemicals that will specifically block the activity of CREB in acute myeloid leukemia cells. Well, many of the new drugs that are coming from the pharmaceutical industry are not specifically for pediatric tumors. And therefore, if we do develop these new molecules, we hope to be able to take them into the clinic faster than we would otherwise because of the support from the Pediatric Cancer Research Foundation. Well, being in Silicon Valley at Stanford is a great benefit because I can receive the advice of many experts in the community who are from the biotechnology or pharmaceutical industry. And they can guide me and counsel me as to how to next proceed with the development of our compounds. Yes, our hope is that we will use this information, use the new compounds that we identify to develop further into drugs so that we can begin clinical trials in pediatric patients. One of the most important aspects of being a physician and a scientist is that we can take specimens from patients, obviously with their consent, for example, bone marrow and blood cells. And we study these in the lab. So I always feel that going back to the patient, getting information from the patient's own cells can provide great clues to how we should proceed in our research. One of the most difficult aspects of my job is to treat patients with cancer and yet see them going through their struggles and coming back into the hospital because of the complications from their therapy. And my hope is that by developing therapies that are much better and less toxic will improve their quality of life as well as improve their overall survival. It has a tremendous effect on families because one of the most difficult things when a child is diagnosed with cancer is that it disrupts the whole family dynamic. It doesn't just involve the child, but also their family and their parents and their siblings. And therefore, the more the patient is at home, the more balanced life that they can live. So the current treatment for acute myeloid leukemia is intensive chemotherapy and stem cell transplantation, which have significant complications and late effects, including neurocognitive defects. So we hope that the small molecules that we're identifying and studying in my laboratory will develop into drugs in the future that are more effective and have less complications and toxicity for our patients. I'm very pleased to say that I'm the first researcher at Stanford to receive a grant from the Pediatric Cancer Research Foundation. And my hope is that I will be first of many more in the future. The wonderful aspect of being at Stanford University, Lucile Packard Children's Hospital, is the fact that we have both an adult hospital, a cancer center, and a pediatric hospital all in one site, as well as the major university, Stanford University itself. And this provides wonderful opportunities for collaborations, including other schools and other institutes, for example, the Cancer Institute, the Stem Cell Institute, and also the Chemical Biology Institute, ChemH, here at Stanford. It's through those collaborations that I've been able to make progress in this project that is being funded by the PCRF. The funding from PCRF will help to hire technicians, will help to pay for studies that are necessary to take this project into patient care and clinical application. So it pays for supplies, it pays for some animal experiments, and collaborations with others. It pays for also the development of the compounds. Since we work with chemists, they need to actually do the chemical reactions to make these new compounds that have never been tested before for human use. I'm very grateful for their support because it enables me to do research that would otherwise not be funded.